So I'm going to take a few minutes and talk to you a little bit about a client of mine that is in his early 20s, male, and he has this issue where before he goes to work and before he goes to the gym, he he throws up because he gets so nervous. And what he was describing was he starts to get this body sensation. He might get like butterflies in his stomach, a nervous sensation, or his heart might start to beat pretty quickly. He gets sweaty palms, and then he starts thinking of like worst case scenarios with the gym and at work. And at work specifically, he would talk about uh, his boss kind of being on him about a certain aspect of his job, and he would think about how frustrating that is and how much discomfort he experiences when he's in that position with her, and she just kind of rides him. And one of the other things that he was talking about was when he's driving, he pulls over, and to relieve his anxiety and stress that he can't stand, he just can't take it anymore. He will throw up, and then he feels better. Well, he's getting an increase in cortisol. He's getting like a shot of adrenaline or an increase in his hormone cortisol. And it's kind of like if your bathtub is filling up with water, and then it starts to, if you keep filling it up, it's going to spill over. And the throwing up part is basically, it's like I can't take it anymore. I have to relieve this pressure, and it's a physiological pressure. So the body kind of like expels, and then it goes back to regulation. So it works. It does help people, but everybody knows it's an unhealthy way of relieving stress, but it is effective, and that comes down to a motivation issue and how motivated somebody is to change that, because it does work. But we do work through that and come up with some better ways. So what is the better way to do that? Well, we have this with any kind of fear-based thing, whether it's panic, something you panic about, whether it's something that you have a fear over. We have some exposure therapy techniques that we use. And what I did with him is I had him track. Well, I'm going to have him track his physical symptoms and hold off on throwing off as long as he can. And we're going to see each day how he tolerates the discomfort. And he's going to talk to himself while he's having this discomfort, like it will pass. It's just a little discomfort here. It's annoying, but it will go away. So that's part of the self-talk that he has to do. But he did a really good job of describing what happens to him physically and what happens to him mentally and how stressful it can be. Now, he has, to give you a little bit of a history, if typically what I see with people who have a trauma background like he does, and he was exposed to a lot of yelling from his parents. So he had to kind of go within. When his parents were yelling, he would go to his room, he'd put headphones on, he would isolate, and that would be a way for him to distract himself. So I definitely seen him and other people using negative thoughts as a distraction from the physiological experience, the discomfort that people feel in their body. It distracts them from actually going through the pain. So you have to kind of walk through the fire when you have physical pain like that. And it hurts. It's like, I just want this to stop. And you'll do anything to get relief. But that's where the work is we talked about him tolerating some of the discomfort and proving to himself that he can get through that discomfort, at least long enough to prove that he can do it longer than he thought. I definitely recommend, if you're in therapy and you have these unhealthy coping mechanisms of how to relieve stress, try to stop avoiding, and try to address your emotional experience and your body and put yourself through that discomfort and prove to yourself that you can do it. Okay, that's all I got. Thanks for watching. Thanks.